Welcome to the Legacy Education ICD-10-CM Guideline Review Series. I am Tiffany Roach, the coding coach, and I will be walking through the ICD-10-CM guidelines with you. This video will cover the chapter-specific guidelines for Chapter 21, Factors Influencing Health Status and Contact with Health Services. This presentation is designed to review the ICD-10-CM guidelines that are effective for both fiscal year 2024 and 2025. There were no changes to the guidelines from fiscal 2024 to 2025. Z codes are for use in any health setting, so it's not specific to inpatient or outpatient. Z codes can be listed first or secondary, depending on the circumstances of the encounter. However, there are some Z codes that may only be used as first listed or principal diagnoses. These will be covered at the end of the presentation. It is important to understand that Z codes are not procedure codes, and that a corresponding procedure code must be used in conjunction to Z codes in order to accurately describe the procedure that is performed. Regarding contact and exposure, category Z20 represents contact with and even suspected exposure to communicable diseases. These codes are for use in patients who are suspected to have been exposed to a disease by close personal contact with an infected individual or in an area where a disease is epidemic. Category Z77 indicates contact and suspected exposure that are hazardous to health. These codes from category Z20 and Z77 can be used either first listed or as a secondary code in order to identify a potential risk. Code Z23 is for encounters where vaccinations and inoculations are given. It indicates that a patient is being seen only to receive prophylactic inoculation against the disease. In addition to Z23, a procedure code is required to identify the immunization given, as well as a code for the administration of the injection. Code Z23 can be used either as a primary or secondary code based on the encounter. Status codes will indicate that a patient is either a carrier of a disease or that they have a sequela or residual effect of a past disease or condition. This can include things such as the presence of a prosthetic or mechanical device that results from previous transmission. Status codes are merely informative, as they may affect the course of treatment and its outcome. Status codes and history codes are different. Status codes will indicate the presence of something, where a history code indicates that the patient no longer has a condition. If a diagnosis code from chapters 1 through 20 includes information that is provided by a status code, the status code should not be assigned. For example, code Z94.1 for heart transplant status should not be assigned with a code from subcategory T86.2 for the complication of a heart transplant. The status code does not provide additional details since the complication code indicates the patient has had a heart transplant. When the patient is being weaned from a mechanical ventilator, you should assign a code from subcategory J96.1, followed by a code from J99.11 for the dependence on the ventilator. The next several slides will cover the status Z codes or categories. Z14 for the genetic carrier indicates a person carries a gene that is associated with a particular disease that can be passed to offspring who may develop that disease. A carrier does not have the condition and they are not at risk of developing the disease. Z15 for genetic susceptibility indicates that the person has a gene that increases the risk of that person developing the disease. Codes from category Z15 should never be used as a principal or first listed code. If the patient has a condition that they are susceptible to, and that condition is the reason for the encounter, the code for the current condition should be sequenced first. If they are being seen for a follow-up after treatment has been completed and the condition no longer exists, a follow-up code should be sequenced first, followed by the personal history and the genetic susceptibility codes. If the purpose of the encounter is genetic counseling with procreative management, code Z31.5 should be assigned first for the counseling, followed by a code from category Z15 for the genetic susceptibility. If any personal or family history is applicable, additional codes may be assigned for the history of those conditions. Category Z16 for resistance to antimicrobial drugs should be assigned when a patient has a condition that is resistant to antimicrobial drugs. These codes are used to provide additional detail, so they should follow a code that represents the condition. Category Z17 for estrogen or other hormones and factors represents hormone statuses such as ER positive or estrogen receptor positive and TNBC, triple negative breast cancer. You should assign as many codes as necessary to describe all factors that are present. Category Z18 for retained foreign body fragments will indicate the type of foreign body that is retained. Category Z19 for hormone sensitivity malignancy status indicates whether the malignancy is hormone sensitive or resistant. You should always code first the site of the malignancy according to the table of neoplasms. Code Z21 indicates that a patient has tested positive for HIV, but they do not manifest any signs or symptoms of the disease. And category Z22 represents a person that harbors the specific organism of a disease without manifesting symptoms, and they are capable of transmitting the infection. Code Z28.3 is to be used for patients who are under-immunized. Code Z33.1 is for use as a secondary code, only for use when the pregnancy is in no way complicating the reason for the visit. If this is not specifically stated, a code from Chapter 15 is required. Code Z66 is for when it is documented by the provider that a patient is on a do not resuscitate status at any time within the stay. Category Z67 will represent the blood type of the patient. In category Z68 is used to represent the BMI of the patient that is documented within the medical record. It is important to know that BMI codes are not used during pregnancy. If the BMI is documented by someone other than the provider, you should see section IB14 for further instruction. Code Z74.01 represents bed confinement status, meaning that the patient is bedridden. Code Z76.82 is for use when a patient is on the transplant list and they are waiting for an organ to be available for transplant. Category Z78 will cover instances such as menopausal state and physical restraint status, which should only be used when the patient is placed in physical restraints during an encounter. Category Z79 should be used when a patient has a continuous usage of a prescribed drug for the long-term treatment of a condition or for prophylactic usage. It is not for use when a patient has an addiction to a drug or for the use of medication for detoxing or maintenance programs to prevent withdrawal symptoms. A code from category Z79 should be assigned if the patient is receiving a medication for an extended period of time for a prophylactic measure or as a treatment of a chronic condition, or even a disease requiring a lengthy course of treatment. It can include, but it is not limited to, blood thinners, NSAIDs, and oral chemotherapy drugs. You should not assign a code from category Z79 when the medication is administered for a brief period of time to treat an acute illness or injury, such as a course of antibiotics to treat bronchitis, or insulin to bring a patient's blood sugar down to normal levels. Category Z78 is used to represent a patient's allergy status to drugs, medicaments, and biological substances such as penicillin, anesthetic agents, and analgesics. Category Z89 will represent an acquired absence of a limb, such as your fingers, toes, hands, legs, or feet. This category will have a sixth character requirement to indicate laterality. Category Z90 represents acquired absence of organs such as breasts, nipples, pancreas, kidney, and spleen. In subcategory Z91.0 will represent allergies to things other than drugs and biologicals such as foods, insects, and latex. Code Z92.82 will indicate the patient is status post-administration of TPA that was given in a different facility within 24 hours prior to the administration of the current facility. This code should be assigned as a secondary diagnosis when a patient is transferred into a facility and the documentation from that prior facility indicates that they were administered tissue plasminogen activator also known as your TPA, within the last 24 hours prior to admission to the current facility. This applies even if the patient is still receiving the TPA at the time that they are received into the current facility. The first listed code should be for the condition which the TPA was administered, such as a CVA or an MI. Code Z92.82 should never be assigned on the transferring facility, but only on the record for the receiving facility. Category Z93 is for use when a patient currently has an artificial opening, such as a tracheostomy, colostomy, or a cystostomy. Category Z94 is for use when a patient has had an organ transplanted. Category Z95 is for use when a patient currently has a cardiac or vascular implant or graft, such as a pacemaker or prosthetic heart valve. And category Z96 is for use when the patient has an implant, such as a cochlear implant, artificial joints, or a brain neurostimulator. Category Z97 should be used when the patient has a presence of a prosthetic device, such as an artificial eye, artificial limb, or external hearing aids. And category Z98 is for use to indicate when the patient is status post a procedure. For example, code Z98.85 is to indicate that a transplanted organ has been previously removed. This should not be used for the encounter where the organ was removed, but for later encounters. When coding for this scenario, the complication necessitating the removal of the transplanted organ should be assigned, as well as Z98.85. Category Z99 should be used to represent the patient's dependence on a machine or device, such as respirator, renal dialysis, or oxygen. The next set of Z codes is for use when there is a history of a condition, whether it is personal or family. Personal history explains a patient's past medical condition that no longer exists and is no longer receiving any treatment, but there is the potential for recurrence and it may require continued monitoring. Family history codes are for use when a patient has a family member or family members who had a disease that causes the patient to be at a higher risk of also developing that condition. It is possible for a record to have both a personal history and a family history code, and for these codes to be used in conjunction with screening codes in order to explain the need for that test or procedure. History codes are acceptable on any record, regardless of the reason for the visit. A history of a condition, even if it is no longer present, is important information that may alter the type of the treatment that is ordered by your provider. When using history codes, the reason for the encounter should be sequenced first, such as screening or counseling, and then followed by the personal and/or family history codes. This slide and the next will list the different categories for personal and family histories, such as for malignant neoplasms, mental and behavioral disorders, psychological trauma, and self-harm. Here's a continued list of categories for history of falling, military situations, and medical treatments. Screening for a disease or disease precursor is necessary in seemingly well individuals so that early detection and treatment can be provided for those who test positive for these conditions, such as a mammogram or a colonoscopy. The testing of a person used to rule out or confirm a suspected disease because the patient has a sign or symptom is considered a diagnostic testing, and therefore it is no longer a screening. In the case of a sign or symptom being present, you will assign a code for the said sign or symptom. A screening code may be listed first if the reason for the visit is specifically for the screening exam. It can also be used as an additional code if the screening is done during an office visit. And further, a screening code is not necessary if the screening is inherent to a routine exam, such as a pap smear that is done during a routine pelvic exam. Should a condition be discovered during the screening, a code for the condition may be assigned as an additional diagnosis. The Z code indicates that a screening exam is planned, and a procedure code is also required to confirm that the screening was performed. The categories for screenings are listed on this slide. Next, we have observation codes. There are 3 categories that represent observations. They are for use in very limited circumstances when a person is being observed for a suspected condition that is ruled out. They are not for use if an injury or illness is present or any signs or symptoms related to the suspected condition are ruled out. In such cases, the diagnosis or sign and symptoms should be assigned with the corresponding external cause code. These observation codes are primarily used as principal and first listed diagnoses. However, they can be used as secondary diagnoses when the patient is being observed for a condition that is ruled out and is unrelated to the principal or first listed diagnoses. When the principal diagnosis is required to be a code from category Z38, such as the birth record, then a code from category Z05 for the observation and evaluation of a newborn for a suspected disease and conditions that are ruled out should be sequenced after the Z38 code. Additional codes may be used in addition to the observation code, but only if they are related to the suspected condition that is being observed. Codes from subcategory Z03.7, encounter for suspected maternal and fetal conditions ruled out, may either be used as first listed or secondary diagnoses, depending on the case. They are for use in very limited circumstances on a maternal record when an encounter is for a condition that is ruled out during the encounter. An example being a condition that is suspected due to an abnormal test result. These codes should not be used when a condition is confirmed, and in those cases, the confirmed condition should be assigned. Codes from subcategory Z03.7 are also not to be used if an illness or any sign or symptom related to the suspected condition are present. In this case, the sign or symptom code should be assigned. Additional codes from Z03.7 can be used in addition to a code from Z03 only if they are unrelated to the suspected condition that is being evaluated. Codes from Z03.7 should not be used for encounters for antenatal screening of the mother, and encounters that are for suspected fetal conditions and are inconclusive following testing or evaluation should have the appropriate code from category 035, 036, 040, or 041 assigned. This slide will list the categories of observation codes. Aftercare codes will cover situations when the initial treatment of a condition or disease has been performed and the patient requires continued care during the healing or recovery phase, or it can even be for the long-term consequences of the disease. An Aftercare Z code should not be used if the treatment is directed at a current or acute disease, and in these instances, a code for the condition or disease should be assigned. The exceptions to this rule are Z51.0 and Z51.1, encounter for anti-neoplastic radiation therapy and anti-neoplastic chemotherapy and immunotherapy, respectively. These codes are to be first listed when the patient's encounter is solely for the treatment of the neoplasm, followed by the diagnosis code for the cancer or condition. If the encounter is for more than one type of anti-neoplastic therapy, a code from Z51.0 and Z51.1 can be assigned together. The aftercare codes should not be assigned for the aftercare of injuries. For the aftercare of injuries, you should assign the acute injury code with the appropriate 7th character for the subsequent encounter. Aftercare codes are generally first listed to explain the specific reason for the encounter. They can be used as additional codes when some type of aftercare is provided, in addition to the reason for the encounter. An example of this would be the closure of a colostomy during an encounter for the treatment of another condition. Aftercare codes should be used in conjunction with other aftercare codes to provide better detail on the specifics of an encounter visit, unless otherwise directed with another guideline. The sequencing of multiple aftercare codes will depend on the circumstances of the encounter. Some aftercare codes have the condition included in the title, and certain aftercare Categories will need a secondary diagnosis code to accurately describe the resolving condition or sequela. Status codes may be used with Aftercare Z codes to indicate the nature of the aftercare itself. For example, code Z95.1 for the presence of an aortocoronary bypass graft can be used with code Z48.812 for the surgical aftercare following surgery on the circulatory system. The status code will indicate the surgery for which the aftercare is being performed, and a status code should not be used when the aftercare code indicates the type of status, such as Z43.0, encounter for attention to a tracheostomy. This slide will list the different Aftercare Z codes and their categories. Follow-up codes are used to explain continuing surveillance following your completed treatment of a disease, condition, or injury. They imply that the condition has been fully treated and no longer exists. Be careful, as these follow-up codes should not be confused with aftercare codes or injury codes with a seventh character for subsequent encounter. Follow-up codes can be used together with history codes to provide the full picture of a healed condition and its treatment. The follow-up code should be sequenced first, following the history code. A follow-up code can be used to explain multiple visits. If a condition is found to have recurred on the follow-up visit, then the diagnosis code for the condition should be assigned in place of the follow-up code. Categories Z08 and Z09 will represent follow-up exams depending on whether the condition is for a malignant neoplasm or something other than a malignant neoplasm. Category Z39 is for an encounter for maternal postpartum care and examination. Category Z52, donors of organs and tissues, are used for living persons who are donating blood and other body tissues. These codes should be used for individuals donating for others and self-donations, and they should never be used in cadaver donations. Counseling codes are to be used when a patient or family member receives counseling in the aftermath of an illness or injury, or when support is needed to help cope with family or social problems. The categories and subcategories include, but are not limited to, counseling for contraceptive, procreative, genetic counseling, childbirth instruction, child care instruction, mental health services and perpetrators of abuse, and sexual attitude, behavior, and orientation. Category Z71 represents a person encountering health services for other counseling and medical advice not elsewhere classified. Z71.84 is to be used for health risk and safety counseling for future travel purposes. Code Z71.85 is for counseling of the patient or caregiver regarding the safety of a vaccine. This code should not be used for the provision of general information regarding the risks and potential side effects during routine encounters and the administration of those vaccines. Code Z71.87 is assigned when pediatric to adult transition counseling is the sole reason for the encounter, or when this counseling is provided in addition to other services, such as a chronic condition. If both transition counseling and treatment of a medical condition are provided during the same encounter, the codes for the conditions treated and code Z71.87 should be assigned, and then the sequencing would depend on the circumstances of the encounter. Code Z76.81 is for an expecting mother who visits the pediatrician prior to birth. Z codes for pregnancy are for use in circumstances when none of the problems or complications included in the codes from Chapter 15 exist, such as a routine prenatal visit or postpartum care. Category Z34 for encounter for supervision of normal pregnancy are always first listed, and they should never be used with any code from Chapter 15. Codes in Category Z3A may be assigned to provide additional information about the pregnancy. Weeks of gestation should not be assigned for pregnancies with abortive outcomes. elective terminations of pregnancy, or postpartum conditions, as the weeks of gestation are not applicable to these conditions. The date of the admission should be used to determine the weeks of gestation for inpatient admissions that encompass more than one gestational week. Category Z37 for the outcome of delivery should be included on all maternal delivery records, and that should always be a secondary code. Codes from category Z37 should never be assigned on the newborn record. Z codes for family planning or procreative management and counseling should be included on an obstetric record, either during the pregnancy or the postpartum stage. This slide and the next slide include categories and subcategories for your obstetrical and reproductive services. There are Z codes that allow for the description of encounters for routine exams, such as a general checkup, or exams for administrative purposes, such as a pre-employment physical. These codes are not to be used if the exam is for diagnostic purposes, and in the case that the exam is for a diagnostic purpose, the condition or the signs or symptoms should be assigned. During a routine exam, if a diagnosis or condition is discovered, then it should be assigned as an additional code. Pre-existing and chronic conditions, as well as history codes, may be included as additional codes as long as the exam is for administrative purposes and it is not focused on any particular condition. Some of the codes will have a distinction between with or without abnormal findings. The code assignment will depend on the information that is known at the time of the encounter. For example, if no abnormal findings were discovered during the exam, but the encounter is coded before the test results are back, it is acceptable to assign the code for without abnormal findings. When a code is assigned for with abnormal findings, additional codes should be assigned in order to identify those abnormal findings. Pre-op exam and pre-procedural lab Z codes are for use only in the situations when a patient is being cleared for a procedure or surgery and no treatment is given towards any condition. This slide will list the categories and subcategories for routine and administrative exams, such as general or special exams without complaints, administrative exams, and pregnancy testing. The miscellaneous Z codes will capture various healthcare encounters that do not fall into one of the other categories that we've already discussed. For encounters that are specific to prophylactic organ removal, such as the removal of breasts due to genetic susceptibility to cancer, the principal or first listed code should be from category Z40, followed by the appropriate code to identify the associated risk factor, such as the genetic susceptibility or family history. If the patient has a malignancy of one site and they are having a prophylactic removal at another site to prevent a new malignancy or metastatic disease, a code for the malignancy should be assigned secondary to code Z40.0. Code Z40.0 should not be assigned if the organ removal is a result of the malignancy, such as the removal of the testes for the treatment of your prostate cancer. The miscellaneous Z codes and categories are as follows. Category Z28 should be used when immunizations are not carried out for whatever reason. There is one exception that we've talked about earlier, subcategory Z28.3 for under immunization status. Category Z29 is for other prophylactic measures such as immunotherapy, Rho-D immune globulin, and HIV PrEP. Category Z40 is used for prophylactic surgery, such as the removal of breasts, ovaries, and fallopian tubes. Category Z41 is for procedures that are not done for remedying a health state. So this can include cosmetic surgery, routine circumcisions, or ear piercing. Category Z53 should be used when procedures and treatments are not carried out. This category includes the treatment that is not completed due to smoking, religious beliefs, and even a laparoscopic surgery that is converted to an open surgery. Category Z72 includes problems that are related to the patient's lifestyle, such as tobacco use, lack of physical exercise, and even high-risk sexual behavior. And category Z74 includes problems that are related to provider dependency, such as a reduced mobility and continuous supervision. Category Z75 includes problems that are related to medical facilities, such as medical services that are not available in home, awaiting admission to an adequate facility elsewhere, and holiday relief care. Code Z76.0 is for an encounter for issue of repeat prescriptions. Code Z76.3 is for use when a healthy person accompanies a sick person to the encounter. Code Z76.4 is for other border to a healthcare facility. Code Z76.5 is for use for a malingerer, including when a person is feigning an illness with motivation. Subcategory Z91.1 should be for use when a patient is non-compliant with medical treatment or regimens. Subcategory Z91.A is for use when a caregiver is non-compliant with a patient's medical treatment or regimen. Code Z91.83 is for use when a patient wanders and there is another disease present. This code should be secondary to the underlying disorder that is present, such as Alzheimer's or intellectual disabilities. Subcategory Z91.84 is for use for oral health risk factors, such as the severity of dental caries or cavities. And code Z91.89 is for other personal risk factors that do not fall in other subcategories. Some Z codes are nonspecific and can result in little justification for their use in an inpatient setting. Their use in an outpatient setting should be very limited to when there is no further documentation to allow for a more precise code. Otherwise, any sign or symptom that is captured in another code should be used. The nonspecific Z codes and categories are listed on this slide. The codes and categories listed on this slide and the next are only allowed to be reported as principal or first listed diagnoses, and the exception is when there are multiple encounters on the same day and the medical records for the encounters are combined. Social determinants of health codes that describe social problems, conditions, or risk factors that influence a patient's health. These codes should be assigned when the information is documented within the medical record, and you should assign as many social determinants of health as necessary to describe all of the social problems, conditions, and risk factors that are documented during the current episode of care. For example, a patient who lives alone may suffer an acute injury that temporarily impacts their ability to perform routine activities of daily living. When this is documented, this would support the assignment of code Z60.2. If the patient merely lives alone, but there is no documentation of a risk or unmet need for assistance at home, then it would not support the assignment of code Z60.2. Documentation by a clinician that the patient has expressed concerns with access and availability of food would support assignment of code Z59.41. Similar to the documentation of homelessness, that would support a code from subcategory Z59.0. For social determinants of health found in Chapter 21, code assignment may be based on the medical record documentation from clinicians that are involved in the care of the patient who are not the patient's provider, since this information represents social information and not a medical diagnosis. For example, coders may utilize documentation of social information from social workers, community healthcare workers, case managers, and even nurses, as long as their documentation is included in the official medical record. Patients' self-reported documentation may also be used to assign codes for the social determinants of health. as long as the self-reported information is signed off by and incorporated into the medical record by either a clinician or provider. The following categories will describe social determinants of health, including but not limited to problems related to education and literacy, employment and unemployment, physical environment, housing and economic circumstances, social environment, upbringing, and psychosocial circumstances. As always, thank you for supporting us and stay tuned for new videos in our ICD-10-CM guideline review. Please make sure to subscribe to our channel so that you can be in the know of our newest videos as they are released.